All right, happy Monday. It is June 14th. Happy National Flag Day here in the US. So before we jump into today's video, I just want to make sure I let you know to stick around to the end. I will be sharing a really important update on what I shared in my last video about the Delta variant. So you're not going to want to miss this. And as always, if you find this helpful, informative, I would really appreciate the support. Don't forget to smash the like button, subscribe so you don't miss any updates in the news and what's going on in the health news. And let's do it. Let's jump in. Okay, so today we're going to be going over some of the recent news that has been showing up regarding the adverse events and COVID-19 vaccinations. So first, let's do some updates. According to the CDC, our US national vaccine rate, we are at roughly 173 million. Sorry about that. 173 million that have received at least one dose of COVID vaccine, and 143.9 are fully vaccinated. That's the most recent information that we have according to the CDC. So that brings us to the adverse events in question, which are these heart inflammation instances. So this is coming from VAERS. What is VAERS? It is the Vaccine Adverse Event Reporting System. It is basically our nation's early warning system for vaccine safety. But one thing you want to keep in mind with this system is that they accept submissions from all walks of life, from all different individuals. So from the healthcare provider to the concerned parent, you could submit a report through the website with obviously necessary documentation to support it on an adverse event that you feel is adverse post-vaccination. Something you want to keep in mind. So again, the current issue, since April of 2021, there have been 789 reported cases of heart problems due to COVID-19 vaccinations. And this is across all age brackets. So what are the vaccines that are currently in question in regards to these heart issues? Well, it's the new mRNA technology or virology, the vaccines Pfizer, BioNTech, and Moderna. So I have an excerpt here, actually straight from CDC at the bottom. You can see we've broken it down into the Pfizer and the Moderna vaccinations. And this is showing dose 1 and dose 2. So you can see there's clearly higher instance of episode post-dose 2 than there are dose 1. But we're going to further break this down even a little bit more into the age bracket that federal health officials are concerned about, and rightfully so. We are looking at the age groups based on these observed instances or reported instances into the VAERS system. And among age groups, you can see 12 to 15, the total doses administered, and the number of interesting expected instances of myocarditis or pericarditis. And 2 here on the observed in this bracket of 12 to 15. Then you can see 16 to 17 years old, 79, and between the ages of 18 to 24-year-olds, we see 196. So that equals 277 observed total instances. And further broken down here, we have males. For dose 1, they comprise 65%, but in dose 2, 79% of the total instances. And for females, dose 1, 34%, dose 2, 20%. So what are we seeing here? Not only did we narrow this down between the age brackets, 30 and younger, but now even further broken down into the gender or the sex, being males. So males that have been fully vaccinated, 30 years or younger, are of concern. So what is really happening here? A lot of talk with COVID-19, coronavirus, and inflammation from the virus, and rightfully so. It's a respiratory condition, therefore the lungs have come up. But one organ that has not been discussed as much in the public and through the healthcare officials has been its reaction and the effects on the heart. So what's really happening? The virus, obviously viruses, they cause systemic inflammation, and the inflammation then, if it's left and is prolonged, can do some serious damage over time. Prolonged damage can result in heart attack or stroke, heart failure, or sudden cardiac death. So those are the bigger prolonged issues. But what can we look out for in terms of symptoms so that we can act more readily and hopefully catch any cases before they worsen? So this right here is showing us a nice visual of some symptoms of heart inflammation that we can look out for. Obviously flu-like symptoms such as fatigue, but shortness of breath, swelling in the legs, ankles, and feet, nausea, lightheaded, pain in the neck, abnormal or rapid heart rhythms, or even chest pain. So if you are somebody that have experienced these and you've had 2 full doses of Moderna or Pfizer, or you know somebody, please help them. So what is the CDC doing now? Well, they've called an emergency meeting. It's taking place on June 18th in Atlanta, Georgia. The discussion is a possible link between the Pfizer-BioNTech and Moderna vaccines and heart inflammation. You can see their breakdown here. An interesting point to this meeting is that the meeting is not set to include scheduling a vote for changing recommendations for use of the vaccines. So that is interesting. And as promised, I'm gonna stop this here. I wanted to share a little bit more information and update the news highlight for the Delta variant. What's going on with this Delta variant? According to prominent UK epidemiologists, it is believed that this variant is now 60% more transmissible than the Alpha variant, which was prominently seen in the UK or Britain. It is now considered to be more contagious. I will always leave in the description box below any of the references, the sources, where I find this information, anything to make it easier for you to access the information that you need and to share this information. So you'll always be able to find links to this in the description box below. Growth of the Delta variant has doubled in just under a week, according to Professor Ferguson, who is the director of the MRC for Global Infectious Disease Analysis. He believes there is a risk of a substantial 3rd wave. We cannot be definitive about the scale of the wave. It could be substantially lower than the 2nd, or it could be of the same magnitude. In the US, the Delta variant makes up 10% of infections, according to Dr. Scott Gottlieb, who is a former FDA commissioner and author of Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. Delta cases are doubling in the US every 2 weeks. So continue to stay 6 feet apart, social distancing, wear your mask, wash your hands, do everything you can to continue to protect yourself, from any further transmission. And as always, I will try to get the most up-to-date information, most relevant information out to you as easily and as quickly as possible to make it easy for you to understand what's going on, what can I do. And yeah, if you find it valuable, please subscribe. I don't want you to miss out. Like I said, smash that like button. If you like that, drop me a comment, ask questions. I love engaging. So hopefully you found some value, and I'll see you on the next one.